Hello and welcome to Fit Professionals. My name is Michael Coleman. This video is part 2 in our series on the healing power of fascia. One of the first things I learned when studying to become a corrective exercise specialist and personal trainer was the importance of having a very strong referral network. Of course, no one knows everything. That's why it's part of my duty to refer my clients to other therapies and other doctors who can help them in areas outside of my scope of practice. Right now, don't forget to like this video, share it with your friends, and subscribe so you don't miss a thing. So now, if you could, I'd like to talk about knee problems. As a corrective exercise specialist, I'm supposed to observe movement. So one of the movements is a squat. Even just getting up from a chair. I'm not even talking about like putting weight on, but just watching someone. And some people are quad dominant, so they'll actually pitch forward. They won't be using their glutes, and they'll pitch forward. And so they have some hip issues, and that has a lot to do with how their knees are loaded. And that's another thing to talk about later on. But I wanted to talk about counterstrain specific to the knee, and there obviously would be some connection to the hip. I happen to have a knee here. And if you can kind of give me a story of something that you've seen that you've been able to work with, I'll hand that over to you.
Absolutely. So again, pain lies, right? So you're feeling, and I believe the person, I believe you, you're feeling the pain in the knee, okay?
Just had a quick question.
Yes.
When Brian Tucky, I was listening to him, and he said something that I wanted to ask you about, and it was talking about how when the trillions of nociceptors, right? Trillions of nociceptors, all these different things that are feeling through your skin and all this stuff. The roots, when they hit the spinal cord, there's only, correct me if I'm wrong here, but there are only so many inputs that can be taken, up to the brain. And sometimes these things get backlogged and inflammation too, and that comes back down to the joint. And so my question with this is, how does that play into pain, like the perception of pain?
Yes.
Because I know people who can, really forget about pain. They'll just say, I pushed through it.
Yeah.
And I'm not saying that they're not having dysfunction or that the tissues are perfect. I'm just saying that there are people who can just bear it until it gets to the point where it doesn't move at all, it doesn't function. So you said that pain lies, but I wonder if that was one of the elements. So it's kind of a long-winded question, but can you address that a little bit in your story? So
I'd love to. So you're talking about something that's deep but incredibly important when understanding pain. That's central sensitization.
Okay, yes. Okay.
Central sensitization. And what they've discovered is that inflammation, let's say you injured your knee in football, 25 years ago. Okay. That inflammation from that injury can actually travel up the nerve to the spinal cord and sit in there. And then it goes like a river. It's like a river that branches off. Where is it going to branch off? To that next point off of the spinal cord. Now, 25 years later, you're complaining of a shoulder pain. But I'm working with you, and I find there's something wrong with your knee. I have to go down to that knee and release it because it's stopping up the flow in the spinal cord. Okay, the flow of inflammation and venous flow, et cetera, et cetera. Also, another thing to remember is this cartilage. All the cartilage in the body is connected through fascia. So many times I've had to treat shoulder fascia around cartilage to help the knee. It's just part of the process. So it's about really truly understanding what's happening in each person's body individually. Sure. Trusting the scan in the head, looking at the immobility. So I've been able to help. I've had a handful of people trying to push off knee replacement surgery, and I was able to help them push that off significantly. Now, once tissue is dead, it's dead. I can't bring it back to life. If there truly is zero cartilage, fine. I can't.
I see what you're saying. So bones on bone.
Bone on
bone.
Problem.
Okay.
Fine.
Okay.
But
fine.
It's not a miracle.
Sorry. Okay.
But sometimes it feels like a miracle because I can get rid of some of that pain. And my question always is the pain truly coming from what you see on your scan or MRI?
So my question then is, okay, so we have a patella here too. So glide is a big thing with joints.
That's a big thing.
Okay. So I'm sorry, if from my training, I can assess movement and I can have suspicion. So I have an index of suspicion that this may be where the problem's from, and I just want to make sure whatever exercise I give the person is not going to exacerbate the problem, basically. Yeah. So what role does fascia have in glide?
Oh, this is a fun one. Okay.
Okay. I'm glad you like my questions.
Yeah.
I appreciate it. Okay. Mm-hmm.
So fascia can wrap around the bone as well. And it can actually get so tight, it changes the shape of the bone. So there's a concavity here underneath that patella. The patella sits nicely on that femur. It's supposed to glide up and down when you bend and straighten. But if that concavity is too much or too little, now you lose the glide of that bone. And I can actually release that fascia around the bone, change the shape of it, of the bone, and it goes back to where it belongs. You've got blood flow now going into that bone, making it stronger, and you've got a better glide on that knee, and better for the hip too.
I appreciate that. I just want, just for people who don't have your training, to just explain how, you know, a lot of people think of bone as being just like it. Even this one has the little porousness. Arterials in here. Yeah. But the thing of bone is just like, you know, it's always going to be like that. Or you see it after someone's passed away, you know, in the medical setting, and then it's like, you know, calcified. It's not moving. It's hard. But when you're alive, your bone
is alive too.
Bone definitely alive, and I think even that concept of being able to increase bone density by exercise is important also. Absolutely. So anyway,
you don't break a bone every time you fall, right? So there's some give there.
Okay.
That's what I'm working on, that natural give that's in the bone. And if you go to my website, you can see how my bone was changed from a bony abnormality I had.
Okay.
So check it out.
Okay. And as I said before, what I would like to do and what I'm trying to put together is a mobility program that helps people not hurt themselves and not to do things, you know. I do have experience as a gymnast, and I'm not saying anything against things that I did as a gymnast, but most people really don't need to be gymnasts. They need to be able to get up and get down. They need to be able to pick up things. They need to be able to garden, you know, that kind of thing. I don't think it's necessary for them to have that. The other thing is I'm also a certified yoga instructor, and I think that a lot of people that I knew were hypermobile. They could do a lot of interesting things, but the structure of their body, it didn't always hold the way that I've been trained to look at it. And I do believe that there are muscles that really are there for stability and not you know, shouldn't be overstretched. But again, that's me. So what I'm trying to put together is something that comes up with these basic points. If you look at the foot and ankle complex, if you look at the knee, and all of these things, and if you're moving naturally, I believe that that's mobility to me. There is a basic range of motion that people should be able to move through, and I'm sure as a PT, you know, you went through all that, but I've seen videos with Counterstrain where a person was able only to live to like about 45 degrees, then they get this release, and then they're able to go 90 degrees, and it wasn't stretching that did it.
That's one or two releases sometimes.
So for me, I think it's amazing, and I think that it would be something that would be really helpful for people to do and to understand.
Absolutely.
And to me, I always call what I do functional longevity. And to me, that means that as I get older, and most of the people I'm working with are over 40, some 50, 60s, and they're trying to, you know, be mobile and move and be active. So that's my thoughts. I'd like to finish up with this. Now, I actually have a printed copy because I'm old-fashioned, but whatever we do, there will be a connection online to this article. Good. So I'm going to, it's a mouthful here. Impaired lymphatic drainage and interstitial inflammatory stasis in chronic musculoskeletal and idiopathic pain syndromes, exploring a novel mechanism. So Brian is the lead person on this, and I wanted to talk about, there's some point, I have my computer here, and there's some points he talked about: myofascial pain syndrome, or MPS, the interstitial inflammatory stasis, which was in the title, and then what's also in the title, impaired venous and lymphatic drainage. And I know you have a lot of experience with lymph and lymphatic drainage, so can we start with that? because I saw you brighten up when I said lymph.
Right. Well, that's where you get the stasis, right? You think about a stagnant pond, and if
lots of mosquitoes,
right?
Immediately mosquitoes come on.
And don't touch the water, kids. Right?
Yeah, definitely.
I mean, that's what's happening in your body. Okay. So you don't have drainage out of a structure, right? Of course, it's going to back up. You get stasis.
So just real quick, also in this article, he talks about the cytokines that actually tell it's like you have these gates, and it tells you to hold this together. It's like, okay, this was injured. It needs, I don't know what it's saying. Is it chemically saying you need more repair or whatever? And then how do you tell these little things to like calm down and like get out of dodge? Yeah. So how does that work?
Okay. So that's important to note too, is that it is actually causing a firing of the sympathetic nervous system. Okay. Now you've got muscle guarding, increased stasis, less blood flow. But that's where fascial counterstrain comes in. We're working on a cellular level, that's what we believe with this article, releasing the interstitial tissue. So that the space kind of in between all the structures and arteries and veins, right? We're working on that to get that. If we open up the gates of the lymphatic system, now that gunk, that stasis that's sitting in that interstitial tissue can leave. Okay. That's what I'm doing. We're releasing that fascia, which is again part of that interstitial tissue, and helping it to leave.
So the mechanism. Okay, I was looking at the Jones Institute and listening to some lectures there, and they're talking about putting someone in a comfortable position, as opposed to taking someone to. And to me, I think of it as a safe space. So it's like, okay, you've had trauma, and you're in a bad relationship, or someone's not you, but someone is in a bad relationship. Nothing personal. And then you get to a different area where you have a safe space, where you actually have a functional relationship, not a dysfunctional one. And in that space, you can relax and heal. And that, and so, but how does that work?
I mean, on a cellular level?
Yeah, on a cellular level. How do you find the safe space of in the cellular level?
Right. I mean, that's...
Is it that the body just understands that it's now, like okay, the first thing that you talked about is like that nothing's pulling, so it's okay to relax, and the body would do that naturally?
Right, and it's all the nervous system that innervates that fascia, right? That's where it's coming from. If you pull on it, it's going to guard.
So the fight or flight part. Okay, the nerve innervates the, let's say, tissue, the fascia. Yeah. And then the fascia, depending on what it's around, it's going to hold this gunk. I like that word. Yeah. Easy to understand. And then you are relaxing the nerve gets relaxed, or the fascia. The fascia gets relaxed. Okay, and then it's a reaction to the fascia being relaxed, the nerve relaxes and everything else. Right.
Okay. Now you're no longer sending those signals to protect that area, so it can relax and drain.
And then I was looking at this as something that also can have effects to smooth muscle too, not just, like we're talking
absolutely.
Other, like the liver or other kinds of organs and things are all, so the fascia is around the heart, around the lungs.
Viscera.
These are questions. I'm just making sure. I don't know all of this. I know enough to be dangerous. But my question is just so that people can kind of understand the general concept behind it. Absolutely. And then the other point I wanted to talk about is now a lot of people think they're doing myofascial release with a foam roller. That's literally something. And something I learned as a personal trainer is some self-myofascial release, and being someone who's done body work before, I like to be very specific with the terms I'm using, and it seems like there's some cross-pollination of this term. Yeah. So what does a foam roller do compared to what you do? Just so people can go, well, I know how to release my fascia. I can do it. So can you explain the difference?
Sure, absolutely. So again, that's just mashing the tissue. And my question to you is, was that foam roller helping you long term? Or did you feel like you had to go back to it every few days? Oh, I need it again. I need it again. So my question is, with a foam roller, is it truly making a change for you? And that's where that's where the beauty of this work comes in. There's a long-term effect. So you're foam rolling your IT band. I remember doing this in the clinic as a young PT, and it really hurt. It might loosen up for a day or two, but then it would tighten right back up again.
Okay.
So now I know that IT band holds a lot of different things in there. If you're, for example, there's tender points in that IT band from lumbar spine veins. Right? So I do a specific move, release those lumbar spine veins, and now that IT band is nice and soft and it lasts. So,
well, I think it's amazing.
Read the paper.
Again, I have to read the paper several times. Okay,
I know.
With the dictionary. Okay, but
I won't do it justice.
Yeah. But I do appreciate it. So, learn how to train pain-free. Get the most effective pro tips delivered to your inbox each week by subscribing today to our free newsletter at fitprofessionals.beehive, BEEHIIV.com.